I've been presenting this. This is the 7th edition of the telethon. Now, how is the corona situation in the world panning out? What has the global response been like? But before we look at the pandemic as it stands today, here is Swati to tell us how many global pandemics there have actually been through the ages. It's over to my colleague Swati.
Hi, Sanket. Thank you. So there have been quite a few, if you really look at it, but the big difference between what we're seeing now and over the years is the sort of gaps between the pandemics. So if we go all the way back to the 11th century, we had leprosy. That was the biggest outbreak of leprosy that we had. Then the plague struck twice between the 14th and the 17th century. Then we had the cholera pandemic. There were 7 cholera pandemics from about the early 19th century. For the next 150 years, we had 7 cholera pandemics. Then we had the Asian flu in 1957. But the one prior to that that really was infamous was, of course, the Spanish flu, which was 1918. And we know that came in 2 waves and killed millions of people. And then we had the Asian flu in 1957. 1981 was a landmark year because that was when the first HIV case was detected. And we know that HIV/AIDS has since killed 35 million people around the world. And then in 2003, we had SARS. Since then, we've had MERS, we've had Nipah, we've had swine flu, bird flu, Zika, and now the novel coronavirus. So literally I would say, in the last 15 years, we've had these big potential pandemics come and go. We've been lucky that none of those nailed us as badly as this one has. And this one has shown what a true pandemic can do in absolutely bringing us all to a grinding halt. And the direct link, one of the things you'll see is the majority of these diseases. So 70% of diseases in the world are zoonotics. These are diseases that jump from non-human animals to animals. That's 70% of diseases in the world. So there is such a direct connect between the diseases that can affect us and the environment that we live in and the biodiverse health of that environment that we live in. Because the minute the biodiversity of the planet goes down, that's like the planet losing immunity. And that automatically means it's going to hurt humans, because there's just so many of us around the world. We live closer together. We're that much more connected. All it takes is for the virus or the prion or for a fungus or a bacteria to get on a plane through another human, and then the whole world is in danger. So that's sort of the timeline and list of pandemics we've had, Sanket.
Fascinating details as always coming in from Swati. Thank you, Swati, so much. And now, let me introduce our next set of guests. Abhijit Banerjee, Nobel laureate, is now with us. Thank you very much, Mr. Banerjee, for joining us. Your inputs of what you have to say will be very, very interesting to hear. Indra Nooyi, former CEO of PepsiCo, is also with us. Thank you very much, Ms. Nooyi, for joining us. Lakshman Narasimhan is back with us, CEO of RB. And Adar Poonawala is the head of Serum Institute of India, is also with us. And hopefully, he's going to be the big newsmaker if his experiment works, if that collaboration works. He's taken a huge risk, by the way, and he's spoken about it on our channel. If it works, it'll be great, and we are all hoping for the best. Dr. Roy, it's over to you.
No, I just wanted to ask Abhijit, thanks very much, Abhijit, for joining us. It's great to see you again. We've learned so much in the last 6 months about the virus versus the economy, and it literally is a trade-off. What conclusions, or how have you changed your perspective on lockdowns versus the economy versus partial lockdowns versus looking after the economy? What priorities should any government make, and with a little bit extra focus on India, if possible?
So I think India is almost a test case of what went wrong, in a sense. I mean, I don't blame the government particularly. I think me or no one else, I think, knew much what the experts were saying. Much of it turned out to be false later, or, in the US, we were told not to wear masks and then to wear masks and all kinds of stuff. So I don't blame anybody for getting it wrong. But at the beginning, the thing that we sort of acted in panic. And one of the things that hit directly was the structure of our social support system. So we basically have this social support system which is domicile based. You can only get social support typically only if you're rural and you live in your village. That's the most generous social support. You get Narega and you get PDS. In cities you can get PDS, but that's sort of it. And that particular structure of social support completely failed in that pandemic. So I think that's probably the single thing that I would say most striking about it, is that we now learned that if we want to do lockdowns, we need to think about what's going to happen to the people who immediately lose their jobs and then have to find a way to, towards survival. And we know all the tragedy that have ensued. So I think that's maybe the single biggest lesson we learned, is that we need to have a very different and much more flexible social support system, not one based on the assumption that everybody lives in their own village. That's probably the first thing I think we learned. The second thing I think we're still learning, and in a sense I think the US and especially Europe, I think, came to that much earlier than that, is that I think this was a moment where there was a strong need for just supporting people's livelihoods. And I think in India, we still haven't quite bought that. We are still hesitant to do it. Maybe now the economy has been opened up, but I think we could have dulled that trade-off by just making the shock to demand, the fact that people suddenly found themselves with no sources of earnings, much less extreme. I think if we had done that, I think we would have transitioned. We wouldn't have had a 24% fall in GDP. I think we would have transitioned much better. Now, I think we now understand those trade-offs. We've gone much in the opposite direction, which is to open up a lot, sometimes possibly too much. I don't understand why, Mr. Bachchan will forgive me for saying this, but movie theaters, I don't understand why they should be opened, etc. So I think we have I don't think we have found a sweet spot. And I think that's probably true of many countries. I am right now in Paris, and here we are sort of walking backwards into a second shutdown, I think. So it's a little bit like that everywhere. We're sort of, I think mostly we are flailing. I think some lessons have been learned. I think income support for when the pandemic hits has not generated massive inflation. It has generated better economic outcomes in countries that did it than countries that didn't. But I think in general, we are a little bit still finding our feet, sadly.
Mr. Banerjee, this is Amitabh Bachchan. Yes, I agree that opening up of theatres is perhaps going to cause a lot more damage. But the fact is that the earnings of people who have been associated with cinema, with theatres, with distributions and production offices, they need to start earning money again. And one of the reasons why we want the theatres to open is that people should go out and get normal. Right now, they're just glued to the television, which I know NDTV will love and Mr. Roy will love. But the fact is that they need to get back to entertaining times, and that's why the partial opening up of theatres is good news for the cinema world. But I have another question. Mr. Banerjee, with so much talk of businesses shutting down in China after the pandemic, there has been hope that India will benefit with a lot of these, businesses moving here. But you have said that this may not happen. Could you tell us why?
Well, I just think that it's very hard for businesses to move. Supply chains are so dense now. They're like connected. I buy this thing here, and he buys something from someone else. And if you understand the nature of supply chains, it's easy to see why it's very hard to move them. Because, I buy something from someone, but I'm buying it from him because he buys it from someone else. And that person buys something else from something else. So it's never going to be like, 1 minute I'll just decide I'm going to source it from India, because it's not that one person produces something. That's one part of it. The other part of it is that, of course, China has the option of letting its currency depreciate. Once its currency depreciates, it's going to be more competitive. China has essentially done that all the time through its last 30 years or 40 years of history, it's been very manipulative of its currency. And if essentially it's under pressure, it could let the currency slide a little bit, and that's going to be make it just that much more attractive. I don't think we should mechanically assume that just because Americans are kind of right now pissed off with China, they can constrain American businesses from buying from China. I think that the American businesses know that the Chinese supply chain is really great. They have lots of experience with it. They have very little experience with Indian supply chains. They're going to have, even if you think they're going to switch to India, it'll take many years to build up that same confidence they have in Chinese suppliers.
Thank you, sir. Thank you so much.
And I guess the U.S.-China relations may change. If I can't come to you, Indira Nui, and we got Lakshman. You know Lakshman, don't you, Indira Nui?
Of course, I know him very well.
Right. It's just so good to have both of you here, brilliant minds. I just got to start with the news on the nose, and that is Donald Trump tested positive and Melania Trump tested positive today. So India-China, US-China relations may change, the whole world may change. But America has done a lot of things right, but a lot of wrong signals as well. What can we learn from what not to do and what to do from America? Adapted, of course, to Indian conditions.
Are you asking me that question?
Yes, please.
Okay. First of all, it's very unfortunate that our president has COVID. I wouldn't wish it on anybody. So if there's anything I want to say is that I wish him and his wife the very best and a quick recovery from COVID. But let me talk about what, maybe we could have done and what we should do going forward. I think the biggest lesson we can draw is from the Spanish flu of 1918. And I think if you read the book, The Great Influenza by John Barry, and focus specifically on the last chapter of the book, which talks about what should be done, how should a pandemic response be organized, you'll find that perhaps we did some of those things, but we did it kind of late. The first thing that should have been done is very quick suppression of the virus by going into some sort of a lockdown and figuring out how we should behave as we slowly come out of suppression. That, I think, happened a little late. Second, we didn't have enough PPE available, which calls into question all our supply chains, our global supply chains. I think suppression and slowly coming out of it required ample availability of masks, protective gear for hospitals and frontline workers, and we were running short of that. The third, I think, is perhaps the biggest fault line that was uncovered in this whole process. Responding to the pandemic is like organizing a massive crisis management effort. And to really do that, you need the federal government, the state government to be organized the same way so that you have a docking station from the federal government to the state government in terms of testing and PPE and tracking and tracing and all of these initiatives. So as a country, we move in unison because people travel across the country. Unfortunately, we never practiced for a pandemic. And, when the government system is not working like a fine-tuned machine because we hadn't had pandemics for a long time, I think that we were sort of feeling our way to addressing this pandemic. We recovered quite a bit. The speed at which vaccines are being worked on, how quickly ventilators came, et cetera, is a good story. But I think up front in the suppression phase, I'm not sure we really knew what to do, and I think we paid the price for it.
Ma'am, this is Amitabh Bachchan again. You have always spoken very strongly about protecting our environment. And this pandemic has brought the focus back on how badly we are treating our planet. So again, if I could ask you, going forward, what are the key things we absolutely must not forget?
Thank you very much for the question. Very nice to talk to you, Mr. Bachchan, and I'm glad you've recovered too.
Thank you so much.
The environment is at the core of this COVID discussion, because let me go through every aspect of the environment that has sort of derailed us. It's comical that we tell people to wash their hands regularly with clean water, yet in many parts of the world, there is no clean water available. That's, in a way, a reflection of the environment, because we don't have monsoons and rains and fresh water which are harvested and stored, we're never going to have water available for people. So water is a core issue. Second, COVID affected those who had comorbidities, asthma, diabetes, obesity, all of those issues. And if you look at asthma in particular, it comes because of a bad environment, smog in the air, impurities in the air. And COVID has showed us that if you have less smog in the air, you can actually see the Himalayas, you can see the stars, you can see the blue skies. So I think if there's one thing COVID has done, is that it has told us that we need a clean environment, we need clean air, we need water, we need trees so that we have a cover to pick up the excess carbon dioxide. And we actually need to go back to first principles to think about how to protect this planet. Lastly, the biggest issue is this. We have to rethink our relationship with livestock. I think we mistreat animals. We treat them badly before we kill them, and then we eat animals that have been, really treated with antibiotics and other drugs, which weakens our own immune system. And I think we have to rethink our entire relationship with animals to make sure that they are not the source of viral outbreaks. So, this is not a time anymore to wait for the proof on climate change. I think environmental catastrophes are staring us in the face. And if we don't do something about this, COVID will just be the tip of the iceberg.
Oh, thank you so much, ma'am. Thank you.
Tip of the iceberg. That is, yeah.
Frightening.
Well, Indira Nooyi, you are one of the best top 25 all-time great Indians, and your words meant a lot there, actually. If I can just bring in Lakshman, who's worked with you earlier. Lakshman, a lot of the interesting things Indira Nooyi mentioned about what to learn from America, and one thing that I wanted to ask you about RB and Dettol is the importance of listening to scientists, medical staff, and not doing a layman's approach. Could have been one of the faults of America. I mean, I know your team here, Gaurav he's been just so dynamic in this whole, right from the beginning. I call him a Sardar. He's that dynamic. And I know that may not gel with you or with many others, but you know what I mean. And Ravi is just, he is so passionate. But at least, they may have their views, but they listen to medical advice and to experts. And we have to defer at times like this and say and understand where we don't know everything. Isn't that true?
Well, firstly, it's a real honor to be here. And it's an honor to be on the same panel as Indira. I've learned a lot from her. She's a remarkable, purpose-driven leader. I think your question about listening to science, one of the things that Professor Banerjee mentioned earlier was, in fact, the vastly changing perspectives. As we've learned more about this illness, we've actually seen, things evolve. But having said that, there is clearly a bit of a question around evidence. And is the evidence really robust? Is the evidence, laid out in a way that people can digest? Is it communicated in a way that actually drives behavior change? And one of the things that we have found, and part of the reason, we actually partnered with Yale, with the London School of Hygiene and Tropical Medicine, with Cambridge, with the All India Institute of Medical Sciences, you had Dr. Galeria in here, with Tsinghua in China, and with the National University of Singapore, is to create the Reckitt Global Hygiene Institute. And part of the reason we're doing this is because what we want to be sure of is that there is evidence that people can believe, the importance of masks, wearing it. How do you, in fact, ensure that your life changes? What do you do? How do you behave? Because we need to do this in a way that also translates to behaviors that simple people can adopt. One of the things we found in one of the campaigns we did on hand washing is, it's remarkable, only 20% of the people wash their hands after going to the bathroom around the world. 20%. It's a very small number. And by doing something that we did, with this campaign that we had with TikTok, which of course is not working in India anymore, but we had 125 billion views. We have to simplify this information for simple people, for people that they can actually follow through on it. So you've got to create evidence, and you've got to make it in a way people can digest and they can embrace. So I think it's very important to also keep that piece of it, because this You need 7 billion people to behave differently in a pandemic. You can't just have 20 people behave differently.
Right.
So you've got to democratize this knowledge too.
Very well put. Actually, one of the things we always insist on in all the scientific papers, have they been peer reviewed? Because there's so much, so many conclusions are coming out, conclusions which are changed a few months later when they are peer reviewed. But thank you both very much for being with us. I know Indira knew you've got a board meeting. It's just wonderful to have you. And Lakshman, we are coming back at 8 o'clock, so we've got lots more to ask you. Thank you both very much. Wonderful to have you.
Thank you.
Thank you. We are now joined by Adar Punewala, the person that we all look up to in a crisis like this, because he's taken some amazingly selfless decisions and risky decisions which could really help us beat this, win this war against the virus. I just wanted to ask you, Adar, there was a bit of a setback, which it's great that you stopped and you checked it out and you've gone ahead and you just didn't ignore it like some vaccine developers may be doing around the world. What is the current status? Is that worry of a spinal effect now put to rest? It's got nothing to do with the vaccine. It was something completely different?
Good evening, Pranoy. Amit uncle, nice to talk to you both. Yes, it was a bit of a setback because, it's not like switching on and off a car. If you have to shut down a trial or pause a trial, you have to redo a few things, and we've almost lost a month, and I'm trying to claw that back. The issue that happened in the UK was vaccine. It wasn't vaccine related. It was a neurological disorder. It was unfortunate that that patient got that issue, and apparently some other family members with that, they suffer from the same issues. So it was clearly ruled out that the vaccine is perfectly safe. The Indian drug controller also let us restart. And I think, by December, January, we should be on track by then to have the vaccine license. But again, let's not confuse that with how many people will actually get the vaccine by then. It takes a long time. I'm in touch continuously with all levels and areas of the government to be able to roll out the vaccine in huge numbers and volumes across the country, and that is a Herculean task. So even though we'll be licensed in December, January, by the time everyone gets it, it's going to be a while after that.
Adar, this looks like a huge financial risk you've taken. How much have you put in so far, and how did you manage to come up with this kind of infrastructure for COVID facilities so rapidly and so quickly? I mean, it's quite amazing.
No, that's a very nice question. Early on in March, April, nobody knew if a vaccine would ever work, would be developed. And I took that risk early on, and a lot of my critics said that, if you're betting and investing so much on one or two candidates, what if it doesn't work out? You're going to spend hundreds of millions of dollars of your own money and then have nothing to show for it. And, it was a major risk. Right now, it's looking to be, well-placed risk because, we had to commit at that time. If I didn't take that decision at that time to do it, we wouldn't have the infrastructure today. We would just start to build it. And part of the other reason also is that the whole world is now looking to India to supply vaccines to them, because we and one or two other companies in India started planning in advance and building additional capacity ahead of demand. That's why, the world looks at India today to provide vaccines even to them. And it's going to be a great moment for India when the vaccine is licensed, because we can help out our friendly nations and so many other underprivileged nations in poorer countries in Africa and other places where they can't get access to the $20 priced vaccines that, the big pharma companies are going to be making.
Although hopefully and God willing, something works out positive for you, would you be able to build further the infrastructure that you already have done in case your product becomes worldwide and is recognized worldwide and the need is much larger than what just is required in India?
No, so Bill Gates and Gavi were very kind enough to give us a couple of $100 million to help us and financially support us. And with that, we're also building the world's largest pandemic facility once and for all, which can produce 1 billion doses every year. So, you know, God forbid there are future pandemics or the coronavirus pandemics continue, we will at least be self-sufficient as a nation and also be able to help others. So that's what I'm doing at the moment.
That's wonderful.
We as a league wanted to make sure that we can help out in any way we can and use our platform to reach people and provide health and safety messaging. And so we as an NBA family, and that includes the players, the coaches, the teams, all came together and launched the NBA Together platform. And that platform has 4 pillars. The first is health and wellness. And we've been listening on the telecast how important that is, that we all practice healthy habits, which includes washing our hands for at least 20 seconds, social distancing, staying home if you're not feeling well, and of course, covering your face with either a face mask or a mask. And we wanted to make sure we got out that message and people had the right information and can go to the World Health Organization and other local health officials. So we posted more than 50 public service announcements right away. They were viewed more than 65 million times. And we wanted to really make sure we emphasize that with people. But of course, during this time when you're social distancing, it's a scary time and we have to be empathetic and supportive of each other. So we wanted as a second pillar to launch something called Acts of Caring, making sure whether it's a big act and supporting, you know, organizations that are providing vital services such as food and medical supplies, or a small act that you can do for your neighbor, just as giving a call or dropping off groceries, encouraging people to do that. And we encouraged over 1 million acts of kindness. The other piece is expanding your community. During this time, as we've seen, there's many ways in which you can connect. And one of the ways we did that is really providing health and safety and mental wellness exercises that families and youth can do at home. We did that through our Junior MBA program. The Reliance Foundation is an incredible partner of our Junior MBA efforts in India, where we reach more than 11 million youth. And through the Junior MBA program, we reach more than 60 million youth around the world. And so sharing things that you can do at home as a family, we had over 115 million views of activities people can do. And we just wanted people to stay together connected to the game. And so making sure that we had Q&A with our players and coaches to do that. The initiative, most importantly, raised over $100 million for those impacted by the virus, provided more than 10 million PPEs, whether it be face masks, goggles, gloves, anything that we could do to be supportive, and more than 9 million meals for people that are dealing with food insecurity. So this initiative for us was just about lending our support to everything we're dealing with as a global society and seeing what we can do to be helpful.
Mr. Todd Jacobson, thank you so much for being with us and sharing your views, which I'm sure will be very valuable to all our listeners. We'd like to bring in now Dr. Devi Shetty, who is Chairman and Founder, Narayana Health. Dr. Shetty, you recently said regulatory change can improve India's pool of healthcare professionals because India will face an acute shortage of doctors, nurses, and technicians in the next few weeks and months. So what are these changes, and isn't this the right time for them?
First of all, finally, one of the good things what happened because of the COVID is the dramatic transformation of higher medical education. Mm-hmm. Earlier, medical education was like an elitist affair which can be offered only in the edifice of $100 million medical college. But the recent transformation of higher medical education with the new regulation allows any 100-bed hospital with the specialist and good patient load can become a postgraduate center in training medical specialists, essentially converting the just MBBS doctors as intermediate specialists. Now this has been done now, and this will help a long way in transforming Indian healthcare. But I just want to convey my apprehension about what is going on today. Government has done whatever they can. Today, epidemic can be prevented or controlled by the citizens of this nation. But I'm very sorry to say that we are behaving like the most irresponsible citizens. You drive out of Bangalore city. On the road, you find how many people are wearing masks. you rarely find people wearing masks. And we are in Karnataka state, which is supposed to be an educated, relatively educated state. And this is the plight here. I am scared to understand, realize what is happening elsewhere. Now, why should you wear mask? You wear mask to protect yourself, but more than yourself, you protect others. Most of the people who suffer from COVID today are asymptomatic carriers, especially young people. They are super spreaders because they go on interacting with many, many people. They're busy meeting people, interacting, touching, hugging. And they don't realize that the way things are going on, in the next few months, we will not have doctors, nurses, and technicians to take care of these patients. In one of our buildings, just one hospital complex, we have nearly 400 patients, and 200 of our doctors, nurses, technicians are already infected. Fortunately, we saved them all, but anything could have happened to them. What is happening is that the doctor community, nursing community, they are all getting tired, burnt out. Why? Because of the irresponsible behavior of the people. I understand economy has to open, people have to get back to work, shops have to open, and business has to go on. But when you are doing all this, can you at least wear the mask? If you wear the mask, the chances of you getting COVID goes down significantly. And now studies show that if you wear a mask and if you get exposed to a COVID patient, the quantum of virus reaching your respiratory tract is so small that it will only induce immunization. It will produce antibodies. You are getting protected against COVID in the future. So these are and how much a mask costs. So essentially, unless people behave in a responsible manner in practicing social distancing and wearing masks, washing hands, we will face serious problem unless the virus changes its mind and behaves itself and goes away from this country. Otherwise, we are going to have a problem, because everyone must understand that beds do not treat patients. It is the doctors, nurses, technicians, they are at the forefront. And we already have a shortage of all of them. And all the keen, passionate doctors, how long they can go on? This has been going on for nearly 7 months. And one day, if you wear a PPE and go and spend at least half an hour in the COVID ICU, you will know what they are going through. So my request to every citizen is that now the ball is in your court. How the future is going to be decided entirely by all of you. Thank you so much.
This is
Thank you so much. It's really very valuable.
Absolutely. I mean, the way it has been put, imagine you can reduce the load on the doctors and the medical fraternity by just wearing a mask. Just one mask. That's all that it takes. Thank you very much, Dr. Shetty. I think this message must be heard by everyone. I would also like to introduce Mr. Ashutosh Raghuvanshi, CEO of Fortis Healthcare. Dr. Raghuvanshi, tell us how much have patients of other chronic diseases suffered due to the lockdown? See, because this is also equally crucial.
Yeah, I think that has been one of the biggest tragedies. Early on, when their patients had a lot of fear coming to the hospitals because of presence of COVID patients, a lot of patients didn't access healthcare, and a lot of people who had malignancies, for instance, cancers of different kinds, many of them became inoperable or became more complicated than they would have normally been. So I think that has been a very big problem throughout. And I think it is important for people to understand the hospitals today are very safe for people who don't have COVID. So if they need to access healthcare facilities, I think it is very important for them to understand that there are enough measures in place for keeping them safe and secure. So for us, it was a priority was to first make sure that all the doctors, healthcare workers are safe enough to be able to provide care. And then the people who need care are safe from acquiring any infections in the hospitals. So I think the number of people who require non-COVID related treatments has steadily been going up from the month of April, where it was barely like 10%. Now that is approximately about 60 to 70% of the patients who require care. So that's a good thing.
That's a good thing, right. Yeah. Dr. Raghuvansh, thank you very much for joining us. Let me now also introduce Dr. Hemant Deshmukh, Dean of KEM Hospital. Mumbai's KEM Hospital, in fact, was Dr. Deshmukh one of the 10 centers across India that was to host phase 2 and phase 3 trials of Covishield, the pre-COVID-19 vaccine developed by Oxford University. After the recent setback, will they resume? Can you tell us about the latest situation?
I'm actually bound by confidentiality of the COVID trial here, and the ethics committee as well as ICMR prohibits me to talk openly to the media about the progress.
Sure,
but two things that I would like to really mention here is the Covishield vaccine or the Oxford vaccine trial is definitely on. We have already screened almost 100 patients, or rather 100 volunteers, and we have given vaccination to at least 21 volunteers up to this day.